Hello, friends. We are starting with a new chapter that is international health, and today we are learning about the different functions of WHO. So, what is WHO? WHO, World Health Organization, is a specialized non political health agency. It is unique among the United Nations specialized agencies in that it has its own constitution, governing bodies, membership, and budget. So, the first function of WHO is to act as the directing and coordinating authority on all matters related to international health. It means that all member states, that is, countries that are a part of WHO, come together to identify the priority health problems affecting population across the globe, collectively find policies and set health targets, and then work together to formulate strategies and programs to tackle those problems and achieve these targets. WHO also has a specific responsibility in promoting and setting international standards in the field of health, which includes all disease prevention and control, biomedical research, etc. It collaborates with other United Nations organizations to meet its objective. WHO's major areas of work can be easily remembered using the mnemonic A to H, where starting with A for prevention and control of all diseases, including the communicable and non communicable, B stand for biomedical research, C for cooperation, D for development of comprehensive health services, E for environmental health, F for family health, G for general information and health literature, and H for health statistics. So, A is for all diseases, prevention, and control. The global eradication of smallpox is an example of international health cooperation. Now, the current focus is on poliomyelitis. An important activity of WHO is epidemiological surveillance of communicable diseases. The WHO collects and disseminates epidemiological information on disease subject. The activities of WHO has also branched out into fields of vector biology and control, immunology, quality control of drugs and biological product, drug evaluation and monitoring, and health lab technology, as these activities are relevant to both the control of communicable and non-communicable diseases. Immunization against common diseases of childhood is now a priority program of WHO. B stands for biomedical research. The WHO does not itself do research but stimulates and coordinates research work. It has established a worldwide network of WHO collaborating centers besides awarding grants to research workers and research institutions for promoting research. C stands for cooperation. WHO collaborates with the United Nations and with other specialized agencies and maintain various degrees of working relationship. Besides, WHO has also established relations with a number of international governmental organizations. D stand for Development of Comprehensive Health Services. WHO's most important single function is to promote and support national health policy development and development of comprehensive national health programs. This include a wide variety of activities such as organizing health system based on primary healthcare, development of health manpower and utilization, building of long-term national capabilities, particularly in the areas of health infrastructure development and health services research. WHO also supports and provides technical assistance to the government. E stand for environmental health. It advises government on national program for provision of basic sanitary services. Activities are directed towards protection of quality of food, water and air, ensuring health protection at workplace, protection against radiation, etc. F is for family health. Family health is one of the major program activities of WHO and is broadly subdivided into maternal and child health care, human reproduction, nutrition, and health education. The chief concern is improvement of quality of life of the family as a unit. G stand for General Information and Health Literature. WHO acts as a clearinghouse for information on health problems. Its publication comprises hundreds of titles on a wide variety of health subjects. The WHO library is one of the satellite centers of the Medical Literature Analysis and Retrieval System of the US National Library of Medicine. WHO publishes material on various health issues for general population. H stand for Health Statistics. It publishes weekly epidemiological records, World Health Statistic quarterly and annually. In order that the statistic from different countries may be comparable, WHO publishes International Classification of Diseases, which is updated every 10th year. So with this we have come to an end of this lecture. If you found this video helpful, like it, share it and subscribe for more.